In this unit, we will review normal fluid and electrolyte balances in the body. To maintain cellular homeostasis, the quantity and composition of body water, both inside and outside of the cell, must be controlled. When imbalances occur, disease and death may result. This pie chart illustrates the body's fluid compartments. Total body water is distributed between 4 compartments. First, there is the intracellular fluid, also known as the ICF. This is the fluid found inside of the cells, and it accounts for about 65% of the total water in our body. Extracellular fluid, or ECF, is all of the fluid outside of our cells. The extracellular fluid is further divided into smaller compartments. There is the intercellular fluid, also known as the interstitial fluid. This is the fluid between our cells, and it accounts for about 25% of the fluid. Plasma is the water or the fluid found inside of our blood. And then transcellular fluid are other fluids that are found in the body. This includes fluids in the GI tract, various glandular secretions, the fluid inside of our eye, fluid in the urinary tract, and fluid in our airways. There are 2 main boundaries that separate these compartments. The first boundary is the cell membrane. This separates the intracellular fluid from the extracellular fluid. And then the other boundary is the capillary membrane. This separates the interstitial fluid from the plasma inside of our blood vessels. The concept of bulk flow says that water and any dissolved particles move together and freely from one compartment to another. Both membranes, the cell membrane and the capillary membrane, are freely permeable to water and anything dissolved in that water. In the body, there is a balance concept. We like things to be maintained at normal levels and in a neutral balance. Neutral balance means input matches output. A positive balance is a scenario where one substance begins to accumulate more than the others. A negative balance represents a deficit in one or more substances. Water is one material that needs to be balanced in the body. Water input, where we get most of our water from, is through drinking. But water can also be acquired through the solid foods that we eat, and water is also a product of cellular respiration. Water output, most water is lost from the body through our urine, but water can also be lost in our feces, through our skin with sweating, and also via breathing. It is very important in the body that input equals output. When it comes to electrolyte concentrations and electrolyte balance, there are certain key terms that must be understood. First is solute. Solute means particles. These are the particles that are mixed with our body's water. Solvent refers to what the solute or the particle is dissolved in. The most common solvent is water. Solution refers to the solute plus the solvent. Ions are particles that carry a charge and can conduct electricity in water. Electrolytes are the same as an ion. Cations, these are particles or ions that carry a positive charge. Anions are particles that carry a negative charge. Concentration refers to the ratio between the amount of solute and the amount of solvent. In our body, particles can move across our boundaries, either the cell membrane or the capillary membrane, via various mechanisms. The first mechanism we will look at is diffusion. Diffusion refers to the net and random collision of solute and solvent particles. This produces a net particle motion down a concentration gradient from an area of high solute concentration to an area of low solute concentration. These particles will continue to move until equilibrium is achieved. As you can see here, with the direction of the arrows, we have a very high concentration of particles on this side of the membrane, very low concentration on the other side. So particles will move from this area of high concentration to an area of low concentration. They will continue to move until equilibrium has been achieved. Once equilibrium has been reached, diffusion does not stop. Diffusion will still occur, but there will no longer be a net change in concentration between the two areas. So you see here, the arrows are moving equally in both directions. There is no longer a concentration gradient, but diffusion will continue to occur equally in both directions across that membrane. Movement through our cell membrane can occur via different ways. Small molecules and ions have no problems diffusing very easily through small pores in the membrane. Any molecule that can dissolve in the lipids of our cell membranes also can pass freely through the membrane. Other materials, however, need to use special membrane transport systems because they cannot get through via the first two mechanisms. One of these membrane transport systems is facilitated diffusion. Facilitated diffusion means that the particles are helped across the cell membrane. They are still moving from an area of high concentration of particles to an area of low concentration of particles, but they cannot move by themselves. They need to be helped across the membrane. The other transport mechanism is active transport. In active transport, the particles also are helped across the membrane. However, they are moving against a concentration gradient. They are moving from an area of low concentration of particles into an area that is already saturated or has a very high concentration of particles. Because these particles are moving against the concentration gradient, this process requires the use of energy. The concentration of electrolytes is the same between the plasma and the interstitial fluid. The concentration of certain electrolytes, however, between the intracellular and the extracellular compartments can vary. This is due mainly to permeability traits of the cell membrane as well as ion pumps within the cell membrane, and we will be looking at some of these differences later on. Another means of transport across the membrane is osmosis. Osmosis is very similar to diffusion. However, in osmosis, the particles are not able to move across the membrane, but instead, water will move across the membrane. Osmosis plays a significant role when water moves more easily than the solutes do. Particle concentration is expressed as osmolarity. Osmolarity is described as the total number of solute particles per unit volume of water. It is important to understand that osmolarity depends strictly on the overall number of particles, or the absolute number of particles, not on their size. As long as, for example, there are 10 particles on either side of the membrane, the cell is said to be balanced. It does not matter if the particles on one side are huge and the particles on the other side are very small. As long as there are the same number on both sides, the cell is said to be balanced. In osmosis, water will move from an area of low osmolarity to an area of higher osmolarity. Low osmolarity means there are fewer particles. If there are fewer particles, this means there is a lot more water. Higher osmolarity means more particles. The more particles you have, the less water you will have. So when you look at it in terms of water, this looks just like diffusion we just talked about. Water is going to move from an area where there is a high concentration of water to an area where there is a low concentration of water. Just like simple diffusion, water will move down its concentration gradient from an area where there is a lot of water to an area where there is less water. Normally, the intracellular fluid and the extracellular fluids, the solutions are isotonic to each other, which means they are balanced. They have the same number of particles or the same osmolarity on either side of the membrane. We can look at our cell in terms of concentrations or the concentration of fluids it might find itself in. An isotonic solution, if a cell is placed in an isotonic solution, the particle concentration is balanced. This is our first picture here. You can see that there are the same number of particles outside the cell as there are inside. If the particles are balanced, this means water will also be balanced, and water will move equally in and out of our cell. If our cell is placed in a hypertonic solution, now there is a higher particle concentration outside of the cell compared to inside of the cell. In this scenario, more water will leave our cell and the cell will begin to shrink. If our cell is placed in a hypotonic solution, now there are more particles inside of our cell compared to the outside environment. In this scenario, water will begin to rush into the cell and it will start to expand. This could be very dangerous to our cells because if too much water enters our cells, they may rupture and burst. Electrolytes also need to be balanced. The levels of electrolyte in our body's fluids is determined by balance between inputs and losses, the same as water. The main way we acquire electrolytes is through our diet. We lose electrolytes through perspiration. They are also secreted into the alimentary canal, and they are secreted into the urine. Fluid and electrolytes are regulated in our body primarily through the kidney. The kidney functions to excrete excess fluid and electrolytes, as well as retain them if they fall below normal levels. The kidney cannot provide additional input. The kidney can only reduce losses. The mechanisms by which the kidneys help to regulate fluid and electrolyte balance is through selective reabsorption, tubular secretion. These first two mechanisms act to selectively transport certain ions, either retaining them or excreting them into the urine. The kidney also helps regulate through filtration. Filtration is a non-specific mechanism. Where are these processes regulated? Most homeostatic water regulation is accomplished in the distal convoluted tubule of the kidney. Most particle regulation is accomplished in the proximal convoluted tubule of the kidney. How are these processes regulated? Mainly through hormones. One hormone is aldosterone. Aldosterone acts by regulating sodium uptake. Now, it's important to note that sodium carries a positive charge. If the body is going to retain a positive charge, we have to balance our charges. So if we reabsorb or we take up a positive charge, we need to balance that by losing a positive charge. So aldosterone, for every sodium that is reabsorbed, the kidney will excrete 1 potassium. Potassium also carries a positive charge, so we are exchanging 1 positive charge for another. A second hormone is atrionatriuretic factor. This is secreted by the atria of the heart in response to their distension. When there is excess water in the volume or in the body, this is represented by an increase in blood volume. The more blood volume there is, the harder the heart will have to work. So as this increase in blood volume comes through the heart, it will distend the atria. The atria responds by secreting A and F. This increased amount of A and F will then block sodium reabsorption, prevent the body from holding on to sodium, and at the same time promote the loss of water from the body. As water is lost, blood volume will decrease. The last hormone is antidiuretic hormone. This acts by increasing the water permeability of the collecting ducts in the kidney. What this does is it acts to draw water into the interstitial fluid and prevent further water loss. If you look at the name of the hormone, antidiuretic, and think about it, it makes sense. If somebody is taking a diuretic, they are trying to lose water. So an antidiuretic would be opposite that. Antidiuretic helps you to hold on to water. This final flow chart shows how water is regulated in the body. If there is a reduced blood volume, meaning there's less water in the body, which will result in less blood volume, or if the extracellular fluid has an increased osmolarity, higher particle concentration compared to water, both of these will result in the stimulation of receptors in the hypothalamus. The hypothalamus responds in two ways. One, it will increase your thirst drive, causing you to increase your water intake. As you drink more water, this will help to increase your blood volume and decrease the osmolarity of your extracellular fluid. The hypothalamus will also stimulate the release of antidiuretic hormone from the posterior pituitary. This too will act by causing the kidney to retain water, holding on to water, which will increase your blood volume and decrease the osmolarity in your extracellular fluid.